Okay. Good afternoon,
Good
doctor.
afternoon.
Okay, how are you today, doctor?
Oh, very good.
Very good, alhamdulillah.
Yeah.
Okay, doctor. Maybe I want to know what's your name, doctor?
My name is Yudi Tanta.
Okay.
Mm,
How long you work in RSUD Siti Fatimah?
I have worked here since this is I think in
Hmm.
2022 or 2021 is the beginning I work here.
Okay. Okay, doctor. I will explain
Yeah.
first, and I will introduce myself. My name is Anissa Priati. I'm student in PhD Nursing Lincoln University College. Then I already informed you yesterday that from Ms. Daisy
Okay.
want to interview you about my research.
Okay.
That okay, maybe I will begin
Yeah.
about first question. What is your view as a medical doctor on the increasing trend of patients with chronic disease using illegal herbal medicine purchased through e-commerce? What do you think about that?
So I think first, I want to clarify about the illegal herbal medicine. So, what does you mean by illegal,
Illegal.
especially illegal?
Okay.
Because uh, sometimes, like many, not pharmacies, but some kind like company, herbal company,
Mhm.
it's already registered to
The
our
product.
the product is
Okay.
already registered to our
Okay.
BPOM,
Okay.
but actually it doesn't follow the procedure like the medical,
Oh.
the pharmacological that we use
Oh.
in medicine daily.
Okay, I will
So
clarify first about the illegal medicine. This is about the product. They commerce about it's herbs and safe, but when pharmacists see it's there is consist with like dexamethasone
okay, okay,
or
I understand.
steroid
Yes,
or paracetamol,
yeah,
some kind like that, but they don't mention it
yeah,
in their product.
of course.
Okay, nah, that's illegal medicine herbs that not herbs
Okay,
like that.
yeah,
And
and
some kind, for example, in e-commerce, many product that there is no unregistered BPOM.
okay,
No unregistered.
yes, okay.
That's the meaning of illegal herbs
Okay.
in this context.
Okay. Yeah.
Okay.
So, if that's what you mean, I think it's so many in. So I think in Indonesia or especially in this region in Palembang, I met so many patients who use that. So yeah. Is there anything you want to?
You know about
Yeah. Yeah.
okay, based on your experience, that what you need about the symptom and some kind what the type they use
Oh,
the
okay.
product.
So usually the patient generally complains about like bone or cartilage or muscle soreness. So then they will buy some
Some
herbs like that.
Mhm.
So sometimes it also we often find it in chronic diseases like chronic kidney disease, heart failure, and diabetes, the advanced one. Because I think there's some misperception, a big misperception in our society that drinking medicine is actually bad for your kidney and for your maybe sometimes they said yeah. So that's the general misperception that we often found in daily
Okay.
practice.
Okay. Why do you think this trend is increasing? What the factor can make this issue increasing in Indonesia?
I think so. Why this is increasing? I think a lot of factors coming for that. One, social media is very, we know it's very powerful. And then also that maybe from our side, the healthcare. The healthcare system is not promoting. I think not putting enough effort in promoting that actually the medicine is not like that. So we does not provide enough effort to change the misperception that happened in. So I think the healthcare system is rather passive in this matter.
Okay. Are there specific demographic more likely to use them? Maybe in Palembang, there is a habit from that demographic.
I don't understand.
Okay. For example, in Java, they always using the jamu
Yeah.
for
Okay.
their habit. And in this your experience, that you need, is it because the region or because of the habit in some kind of the region? For example, I don't know, in Palembang they always using the herbs or no, but in Java they always using jamu
Yeah.
for if they have the fever
Yeah.
or they feeling unwell when
Oh, I
something
see,
like that.
I see.
What about this your experience in this state?
I think it's the same. It's kind of the same. So I think the jamu ingredient, if they cook it themselves, it's also something that we daily use in our food, right?
Okay.
Like ginger,
Ginger.
and some kind, etc., etc. It's not something that odd, yeah, something like that. Yeah. But if they buy it in the sometimes like you said before, it's already on a product, and they claim it as a natural. Usually we will find it turns out it has dexamethasone or methylprednisolone, something like that, and then we got the patient several months later as Cushing syndrome.
Okay. What do patients usually say about this product when you meet them?
They
Based their perspective.
Okay, if I haven't explained to them, they said that this is a very good product, and they cannot live their daily life without that product, because the moment they release it, they will feel like foreigners, something. So it become dependable for them.
Okay. Have you ever treated patient who experience complications resulting from the use of illegal herbal medicine?
Oh, many.
Okay, can you explain this your experience?
The most common the most common complication we found is gastrointestinal bleeding. The second most common is Cushing syndrome.
Cushing syndrome. Okay. What were the symptoms or condition that you see? That's the disease you say. But about the symptom, maybe abdominal pain or something like that. Something like that. The symptom
usually they will feel abdominal pain, or they will feel like heavy general weakness. So they feel like they don't have energy, something.
Okay. How is the treatment handled by you?
So of course we will handle it by as the protocol, as the treatment protocol, in either in gastrointestinal bleeding and also in the Cushing syndrome.
Okay, depend of the symptom and the disease.
Yes.
Okay.
Yes.
Okay. Was there any lasting impact on the patient health after they using that, from this your perspective?
The lasting patient. I'm sorry. Can you?
Lasting by your experience that you ever meet that patient that you already caring, that is it so many impact from after they using that herbs medical, and what you see from that is side effect?
Okay. Usually, if they continue, usually in the beginning of they consuming the product, usually they feel they get better. They a lot better actually. But after several months, many things happen. Many things happen. So if we doesn't catch the patient, and then we doesn't interrupt this habit, so they will get in a very bad condition, such as they may have massive gastrointestinal bleeding. That in some cases maybe they require surgery, or in some cases they have to get many transfusion. And then Cushing syndrome, of course, we will deal with like high glucose level, and also a lot of like maybe spontaneous fracture. So a lot of things. And then if we don't interrupt it, it will continue, and it will be, yeah, it will get devastated.
Okay.
So yeah, I think that. And then one thing should be point out that the problem is that to stop is not that simple. We have to gradually stop the steroid, yeah, because if we stop it suddenly, they will get to some disease we call as Addison disease.
Okay.
Because their hormone, their steroid hormone, is already so much depend on the product. So like their glands, all their glands is become retarded.
Yeah.
Yeah, because of that. So to stimulate the gland, we have to gradually decrease. We cannot just suddenly stop the steroid. Of course, we will not use the same herb, but we will give the steroid in low dose, something like that. Step by step.
Okay. Okay, next question. In your opinion, what are the main reasons patients prepare illegal herbal remedies over medically approved treatments? Why they choose the medical illegal herbs than the prescribed from the doctor?
Okay. So one thing is that is the commercialism. Commercialism, because we cannot commercialize medicine. It's unethical. But in other side, this product is heavily promoted. That's one thing. And then the other thing is that the long-standing misperception. Yeah, as I told before. So like medicine is something like chemistry product. It will disturb your liver. It will disturb your kidney. It's the common misperception that happen in our society.
Okay.
Yeah.
Okay. I will continue with this topic. Is it due to cost, accessibility, culture beliefs, or distrust in conventional medicine? What do you think about this statement? Cost, accessibility, culture belief, and distrust in conventional medicine. What do you think about?
I think the last two is the more dominant one. Because I think we have the BPJS. I think medicine, insurance, our national insurance.
Okay.
So I think it helps a lot. It helps a lot. So I think cost is less likely the problem. Uh, Accessibility, I think, I don't know, in very rural area, but I think in my daily practice it's not the problem too. But I think the misperception, and also the promotion of this product.
Okay. How much influence does online marketing or testimonial commenter from the e-commerce that will be impact in Indonesia? What do you think about that?
I don't understand.
Okay. Uh, in this research, I focus with the herbal medicine who sold through in e-commerce. Then I want to know about the perspective about people who sold that in e-commerce. Then the patient buy it in e-commerce. I mean, like how much the influence that in habit in Indonesia. That's mean. Do you think that patient in Indonesia, your patient, especially your patient, it's so influenced by influencer, for example, and then they use that product because the influencer said that.
Yeah,
Did you agree or you disagree, or what
I
about your
agree.
opinion?
I agree. So our society, I cannot say that we have a very diverse society. Some society is already, we can say they are on an educated group, and some is in not so educated, and some very less educated. So sometimes they just said that I watched this YouTube or TikTok video. It said like this, doctor. They will confront me. For example, if I said, uh, "Ma'am or Mister, I have to give you insulin for your diabetes, and it is in a form of injection." And then they will say, "No, doctor. I watch in YouTube or TikTok. There is an insulin that we can drink."
Yeah, yeah.
And they believe it, everything that can be put on YouTube or on TikTok is a truth.
Okay.
It's very much. It's very many.
Okay,
Yeah.
so I clarify that you agree that influencer can influence the all patient to believe that this medicine is safe and they consume then buy it in commerce, right?
Yeah.
Okay. Okay, next question. What long-term health risks may arise from the continuous use of illegal herbal medicine?
I'm sorry.
What the effect that if patient using that medical herbs for a long term, that will be they have
The effect.
the effect, yeah, the
effect
side
of
effect,
the health.
yes, that's your
I cannot set so it's the product is the variety is very many. So some have steroids. Of course, the steroids we know the long term and the uncontrolled using of the steroid will have gastrointestinal bleeding, the Cushing syndrome, etc., etc. Some doesn't have steroid, some doesn't have steroid. So, but for example, the like slimming product, something like that, that turns out diuretics.
Yes.
So, of course, we'll have another side effects like dehydration, electrolyte imbalance, something like that. And some maybe they really putting herbs. We don't know. We cannot set that. We cannot assume that all the jamu is will be put will have steroid material there or diuretic. We cannot assume that.
Yes.
Yeah, but we know that many of the product also are
Consist
using
with the
consist with-
ingredients.
yeah. So it will depend.
Okay. Are there specific organs or system at risk after they use that?
Yeah.
What specific organ?
Like I said this before. Gastrointestinal for the one that have
Damage, the damage.
steroid in the product. And Cushing syndrome. Cushing syndrome is a very systemic disease. So they will have imbalance in glucose metabolism, and then they will have renal impairment, kidney impairment, and also they will also can have osteoporosis from misuse of steroid. And as I said before, many each ingredient will have different side effects.
Next question: can herbal medicine interact negatively with the prescribed from the doctor? For example, there is patient using the herbs medical and then use from the pharmacist. They using to one go.
It potentially can. It potentially can, but we cannot assume what interaction will be because it varied so much. It varied so much. The ingredient is
depend on the product.
Yeah, depend on the product, and then also the does this product like we said, is this ingredient is honest? The ingredient in the label is honest, or they put something.
Because we don't know about the laboratory, the ingredients. What is the role of doctors, you as a doctor, in educating patients about the dangers and safe use of herbal product?
So I said that usually I just said I cannot recommend it because of course health medicine is two ways. I mean that it need like cooperation. So it's not like one way treatment. It's like doctors and to the patient, but doctors and the patient cooperating together because we have to understand also the situation of the patient sometimes. So it's some kind of cooperation, not like one side. So I just said that I cannot recommend it, but I cannot blame the cultural. So, but if you want to, usually I said that if you want to try the traditional tea or traditional cuisine, make sure that you have it from the natural ingredient, not something you buy like fast package something. So you cook it by yourself. And actually I don't know much about the traditional medicine, but as long as it's not the ingredient is not hot enough, why don't? And we know that the ingredient is not contraindicated for his or her disease. Why not? because it's just something like food, like
Okay.
yeah. As long as they don't buy it, like for me,
Okay. Do you provide such education during consultation with your patient?
often.
Okay.
Yeah.
Okay. Can you explain for this your experience? What you do for the consultation session?
Uh, Usually, the patient asks me, doctor, if I drink this, is it good for my disease? I said that actually, if I know, I would say like celery. I don't know what in English celery. It has
Celebrity.
it it has an
Okay.
anti-hypertension effect.
Yeah.
Yeah, it may help a bit, but of course you still have to take medicine, something like that. But you need to cook it by yourself. Don't buy.
Don't buy
Yeah,
just a product that
because
you
I cannot assure the
the product.
the ingredient of the product.
Okay.
Like that. Yeah.
Okay. Are standard protocol or material when you doing the education? Maybe like
No, there's not
booklet,
standard.
leaflet, something.
No. I'm
Just
not that diligent.
only just verbal explanation
Yeah,
for
yeah,
the patient. Okay.
yeah.
What barriers do you face in delivering this education? What you challenges? For example, maybe there is limitation when you giving the information to the patient. Maybe the patient not accepted what you want to giving the advice to them or something like that.
So yeah,
Did you ever
I
meet
have
that?
a lot of many responses. Uh, Most some good, some not. Some they cannot release themselves with the the product. Yeah.
Because
Because
it's so hard to change that
yes.
their
Because
opinion.
yeah, not. Sometimes it's not that, but because it's just that they are so already so dependable, and then it's the most easiest thing they get. Sometimes like that, yeah. Many things, many factors.
About that. Okay. Do you believe that educational tools such as video and website are effective in raising public awareness about the risk of illegal herbal medicine? What do you think about it?
Potentially, I think uh, the thing is that to maybe we can do is to correct the perception that medicine can harm our organ.
Okay.
So that if we can correct that, we does not said something about this product. We don't affect right, something like that. But we just correct the perception that the medicine used in the standard and controlled dose will not harm your body.
Okay, organs.
Just that, and I think it will help a lot. But our healthcare system, as I know, haven't showed that.
Okay, it's okay.
Yeah.
Have you ever used digital tools in patient education before?
No.
No. Okay, just verbal explanation. What feature would make this tool effective? What do you think about if someday that you make education with the digital platform, something like that? What do you think most effectively that language, visual, or accessibility? What do you
I think
think?
language and visual.
Visual, why?
Yeah,
Can you
because
explain that?
I think social media is very powerful, and YouTube, TikTok, so it's very powerful. It's easily uh, it's easily attainable. They easily get that, and with yeah, I think it's
to get the
yeah,
information.
to get
It's
the
easier.
information it's easier because the products, this product also got promoted a lot by social media, right?
Social media. Okay. What are the challenges that healthcare professional like you and nurse, maybe the pharmacist, that face in limiting the use of illegal herbal medicine among patients? What do you think the most challenges that to stop? Maybe we cannot stop the product, but how can we make more uh, strategies or action to
Mm.
give that stop that habit?
Mm. I think the strategy maybe it's many approach we can use. So I cannot first I cannot always said that I cannot generalize that all the product is contain some ingredient that should not be there, something like that. Maybe the our what we say in the before the testing of the product is
Okay.
more
Before they
before they
the market
yeah
it
but
and
yeah
they need to testing. Okay.
it's also it's that from the that approach,
Mm.
and from our approach we can optimize our education. So not like all the doctors, nurse, they fight by themselves with that, with no some like no
Collaboration.
yeah collaboration to promote uh, and to fix some misconception that we said previously.
Okay. Is it lack of regulation or enforcement a factor? What do you think about that?
Yeah, I think it's very much factor because what's regulation? Eh?
Regulation or enforcement from it's kind of the factor that can make Indonesian people, especially Indonesian people, using that. Is it
Uh,
is it because of the unregulation in Indonesia, like BPOM, just like we say?
mm, I think regulation because
Yeah.
I don't know much about the what
Or
we
the
say
procedure
the
that
yeah I cannot say something objectively about that. But I think the enforcement. What do you mean by the enforcement?
so the people who sell it, it's so in Indonesia so easy to sell like the herbs medicine that they made just by themselves, and they sold in e-commerce, and it can be sold without that unregistered. So they not by doing the step regulation from the BPOM, and then they just make package and then they sell it in e-commerce like that.
Mm.
Is it that the most factor can be make the people easy to get this product?
So I don't know about that because I don't know some patient in my experience some patient got it from their friend, some buy it in some store like that. So
E-commerce.
some buy it from e-commerce. There's so many ways,
Yeah.
so many ways. So I think a lot of things that need to be need improvement. Yeah.
Okay, based your perspective as a doctor, what do you think BPOM regulate it's easy to make it or no?
Before regulation,
Yes.
easy.
Yeah, easy to make it like that. So many people who make the product and then sell without the POM testing like that.
Hmm.
What do you
Maybe
think about that? What your opinion?
I think my opinion is that I don't I don't I mean I don't want to judge
Mm,
something like that. So it would be better, I think, if BPOM uh, got much support, and they will ideally uh, uh, do the work that I know that it's very hard, right? So because of the load,
yeah.
yeah. So I think to do that, I think they need support. They need more support, and then they can do what they should do. I think something, yeah. I think it's that because we know that if the product actually is made correctly, that if the product actually is made correctly, so I think like they doesn't put ingredients that they should not put, something like that. It also, I think it will be less harmful at least, and then yeah, it also maybe help the maybe it will help the if we can do, maybe it also field potential field for many studies, for clinical studies, to know that whether some traditional ingredient have effect, have a benefit effect to some kind of disease or not. And then if yes, maybe it will become some, yeah, some economic, economy in Indonesia, yeah, okay, economy, yeah, I think it's
Okay. That you think that it's hard or no for you that changing the patient behavior or beliefs about that medicine herbal ill, it's hard or no for you when you want to giving that advice something it's dangerous, it's hard or no for you, it's challenging or
in some level they will uh, trust me. So it's depend. Can I build the good doctor and patient relationship or not? If that relation is already been built, it's not that hard. It's not that hard. But in some level, it's not that they don't trust in doctors or nurse and other health provider, but it's just they already so dependable to that product.